So I'm talking about radiation damage in genes. During the course of my career, I've become very aware of the huge number of complications you get, not just with surgery, but with radiotherapy. Radiation damage is due to extreme scarring. Radiation damage can cause speech problems. Many people suffer from this, and it's really bad if you can't be understood over the telephone. Your quality of life nosedives at that point. It causes swallowing problems, and if you have difficulty swallowing liquids, again, it nosedives. You may be dependent on having a feeding tube, may not be able to open your mouth properly because of the fibrosis in the muscle, the scarring, and it makes it obviously very difficult. So the thing that I become involved in is because it's a surgical complication, is osteoarthritis necrosis. Now, it affects about 5% of patients after radiotherapy. This fibrotic process literally rots the jaws. Derek's here, this is his radiograph. Just around here, there's a very grey-black area, and that's his area of osteoarthritis necrosis. Derek's been a patient of mine for a number of years. He first started his treatment in 2000 for a tonsillar carcinoma on the right side, and he developed recurrence, and he had further treatment for which he had both surgery and radiotherapy. But just tell us about the complications, Derek.
Well, the complications with radiotherapy started when I was walking along the road one day and I had a crack and part of my bone came out, pulled it out. I realised I had osteoarthritis necrosis, so I went into hyperbaric chambers for about 40 sessions. They helped for a while, and luckily a few years later I bumped into Andrew, who helped me enormously with some drugs which I'm sure you'll expand on. I went through a period where I've had my osteoarthritis necrosis. I've still got it, but it's kind of held at bay at the moment.
We can treat osteoarthritis necrosis with drug treatment. And one of the ideas between NFORC is we can identify perhaps people who might need this treatment before they develop their osteoarthritis necrosis, because prevention, of course, is better than cure. Now, Margaret also had a tonsillar carcinoma treated with radiotherapy. She didn't really require any surgery until she developed her osteoarthritis necrosis. Now, if you look at Margaret's case here, you get rotting of the bone so much it fractures, and that can be very painful. And in most cases, we therefore have to reconstruct. So, Margaret, you take centre stage.
So I had the 6 weeks of radiotherapy, which I went through with no problem. But at the time I was a much bigger lady. I was a size 24, so I had lots of flesh to eat off for quite some time. I had it all clear after the 6 months, and then 2 years later suddenly the jaw just snapped, and I went in for reconstruction surgery, which was something like 9.5 hour operation, and I've had no pain right from the beginning to now.
Do you think if we could tell you what genes you had and we give you a risk, might affect your decision on what treatment you had?
Certainly would have with me. I wouldn't have gone through this treatment and the hell that it's produced afterwards. You know.
If I had a choice, knowing what I know now, I'd have probably gone for surgery.
I looked at the fact that you could genetically predict who was going to get osteoarthritis necrosis. There's a gene that if you have this gene, a double dose, you're 6 times as likely to develop osteoarthritis necrosis, and if you have a single dose, you're 3 times as likely to develop osteoarthritis necrosis. The way to look at it, I think, in the first case is look at swallowing, because 30% of people have bad swallowing after radiotherapy, and so therefore there's a much greater pool of patients you can look at. Therefore, we're going to do this study with 100 patients who have good swallowing and 100 patients who have bad swallowing. We're going to look at 750,000 different genes. The idea is that if there are really strong genes that are causing the effect, we will find them with that small sample of patients. And I'm very grateful for Liam for the fact that he's helped me get this study off the ground, and of course NFORC. Can we predict who will do badly with radiotherapy by genetic analysis? Maybe in the future with the help of NFORC. Perhaps surgery, robotic surgery, wasn't really online in Derek and Margaret's times. We can use that instead in certain instances. And we're going to be developing with NFORC the increased use of antifibrotic drugs. That I was very fortunately we managed to stop Derek having any further complications.
This is absolutely brilliant, creating the world's first ever research centre dedicated to this most socially sensitive part of our body, which will collect major data and organise research to improve patient treatment worldwide. Well done, Saving Faces.